Hello, welcome to our presentation. My name is Brian, and this presentation is on case study number 4. So introduction, chemical dependency possesses a significant challenge within the nursing profession, exacerbated by high stress work environment and easy access to substances. Research indicates that approximately 18% of nurses exhibit signs of chemical dependency, highlighting the pervasive nature of the issue. Despite efforts to address addiction, many nurses who have successfully recovered from substance abuse are hesitant to re-enter the healthcare field due to strict restrictions and monitoring protocols. Studies reveal that both illicit and prescription drugs are commonly misused among health and hospice nurses, as well as those working in nursing homes. The impact of chemical dependency on healthcare delivery is profound, as it not only jeopardizes the physical and mental well-being of nurses, but also poses grave risks to patient safety. This includes the potential adverse outcomes ranging from compromised care quality to fatal consequences, underscoring the urgent need for comprehensive interventions and support mechanisms within the nursing profession. So understanding the chemical dependency. So chemical dependency, as defined by Kaiser Permanente, is a disease characterized by reliance on mood or mind-altering substances, including alcohol, street drugs, and certain prescription medications. Nurses, due to their exposures and knowledge, are particularly susceptible to chemical dependency compared to many other professions. The high stress environments are primary contributing factors, alongside with the availability of drugs and the influence of colleagues facing similar challenges. The detrimental effects of chemical dependency in nursing are numerous. Not only are nurses at risk, but patients are also exposed to danger, compromising safety measures and potentially leading to fatal outcomes. According to the American Association of Nurse Anesthetists, common indicators of chemical impairment include severe mood swings, personality changes, frequent or unexplained tardiness, work absences, illness or physical complaints, elaborate excuses, refusal of drug testing, and deterioration in personal appearance, and significant weight loss or gain. Recognizing these signs is crucial for early interventions and ensuring the well-being of both nurses and patients in healthcare settings. Role of nurse manager. So nurse managers hold pivotal role within the medical setting, wielding decision-making authorities that influences daily operations. Their responsibilities encompass monitoring signs of chemical dependency, providing support for recovery, and developing policies to facilitate the safe return to work for recovered nurses. Nurse managers are empowered to take actions, including the removal of nurses displaying signs of chemical dependency. Vigilance in monitoring is essential, encompassing behavioral, physical, performance, and emotional indicators of chemical dependency. Educating nurses to recognize and report signs of chemical dependency is also part of the nurse manager's role, emphasizing support and treatment rather than negativity. Supporting recovery efforts involves referring nurses to counseling programs, rehabilitation, pharmacotherapy, and community support groups. Additionally, nurse managers must adhere to Board of Nursing regulations and policies, which outline specific criteria and monitoring requirements for nurses with a history of chemical abuse returning to practice. Despite the treatability of chemical dependency, the risk of relapse remains, necessitating continued monitoring by nurse managers to prevent harm and ensure patient safety. Any suspicions of relapse must be promptly reported and addressed following established protocol. So here's a chart. This chart highlights the significant role of healthcare professionals, including physicians, prescribers, pharmacists, and nurses, in expanding the use of pharmacotherapy for the SCD treatment. The physicians make up to 20% of the medical staff at the SED treatment facilities, supported by the mid-level medical personnel and pharmacists, although comprising a smaller share at 3%, play a crucial role in supporting opioid treatment facilities. And nurses, particularly registered nurses, are the most prevalent type of medical staff in these facilities, delivering comprehensive care, including medication administration and patient support. So overall, this chart underscores the interdisciplinary approach to SVD treatment, emphasizing collaborative efforts among healthcare professionals to provide effective pharmacotherapy and comprehensive care to individuals with substance use disorder. And June will continue the next part of our presentation.
Reintegration into the workforce, considerations, and best practices. Reintegration is a critical phase in the recovery process, requires careful planning and support to ensure the smooth transition, more importantly, to reduce the risk of relapse. We have highlighted four points. Point number one, structural integration plan means a gradual return to work, starting from less stressful and demanding roles to full duties, allowing the nurse to regain confidence and adapt to the workplace environment without overwhelming pressure. Ongoing support and monitoring. We want to refer to mentorship and peer support. Pair the returning nurse with a mentor or a peer that have experienced a similar situation. This provides a valuable resource for advice, encouragement, and sharing experiences, and provides emotional and professional support. Monitoring and support policies develops clear and compassionate policies for monitoring recovery process, including regular check-ins with a designated support person and access to professional support services. Also, drug testing as part of a broader support strategy rather than punitive measures. Education and training. Education programs that focus on stress management, healthy coping mechanisms, and the risks of chemical dependency are beneficial. Encourage participation in continuous education and training to ensure the nurse stays updated with nursing practices and feels competent in their professional role. Training should also cover policies on drug diversion and the importance of seeking help. Workplace accommodations. We're talking about offering a flexible work schedule or reduced hours to help the individual manage stress, attend therapy sessions, and maintain a healthy work-life balance. Another point we haven't included in the presentation, but we're going to mention, it's the need for transparent communication to maintain open and honest communication between the recovery nurse, the supervisor, and human resources department to manage expectations, discuss progress, and address any concerns or challenges, and any adjustments needed to support the nurses' reintegration. Innovative solutions and support systems, like technology-assisted monitoring. These are wearable technology and mobile apps that represent a cutting-edge approach to support nurses in recovery by helping them manage stress and identify potential relapse triggers. There are wearable devices, devices that track physiological indicators of stress, such as heart rate, and can alert about increased stress levels, prompting them to engage in stress reduction activities before they become too overwhelmed. This real-time feedback can be important for individuals in recovery, helping them maintain awareness of the mental and physical health status. Mindfulness and meditation apps. These apps offer guided meditation, breathing exercises, and mindfulness practices designed to reduce stress and improve mental health. By making these tools available, nurses can easily incorporate mindfulness practices into their daily routines, aiding in relapse prevention and promotion of overall well-being. Online support networks. The internet offers powerful platforms for connection and support, breaking down barriers that might prevent nurses from seeking help. Like virtual recovery meetings, online meetings like Zoom meetings that can provide a flexible and accessible option for nurses working in regular hours, like 12-hour shifts or living in remote areas. These virtual gatherings can replicate the camaraderie and support found in traditional face-to-face meetings. Professional forums and support groups, dedicated online forums for healthcare professionals that allow sharing experiences, advices, and encouragement in a more anonymous setting, which can be particularly appealing for individuals concerned about privacy and stigma. Drug diversion prevention programs. Preventing drug diversion in healthcare settings not only protects patients, but also reduces risk of relapse among recovering nurses. Advanced pharmaceutical tracking systems, implementing sophisticated tracking technologies, can monitor and control medication access, distribution, and disposal, making diversion more difficult and detectable. These systems can include automating dispensing cabinets, electronic medication administration records, and waste management solutions. And educating and reporting protocols. Educating staff on the sign of drug diversion and establishing clear and non-punitive reporting protocols are essential components of a comprehensive diversion prevention program. Awareness campaigns and training can empower employees to recognize and report suspicious activities and remain confidential. This is an example of what I mentioned earlier about the technology assisted monitoring. This in particular is a device developed by Stanford. It analyzes breathing patterns and that interprets the emotional health indicators, and it's in real time. Another example would be of the online support network that I mentioned, would be the self-care apps for nurses. I listed 6 of them, and they're available when you need it, when you want it, at any time. Just reaching your phone, you can find it in your app store. And these are apps that are designed to help nurses to cope with stress through meditation and relaxation, mindfulness. They're useful tools at any given time. Substance use can affect any class, gender, race, and profession, and nursing is no exception. Nurses often exude professionalism, appearing calm and courteous in hospital settings. However, these workers, like the rest of society, face personal challenges that cause many of them to turn into drugs or alcohol. Alcohol being the substance of choice. Uh, Nurses with a substance use disorder have impaired judgment and slower reaction times, which compromise their work performance. They may harm themselves, patients, and the nursing profession as a whole. The issue of chemical dependency among nursing staff is a big burden in the healthcare industry, affecting not only the individuals battling with addiction, but also patient care and the broader healthcare delivery system. This analysis highlights the critical need for awareness, education, and proactive measures in managing chemical dependency among nursing staff. It calls for a collaborative effort among healthcare professionals, management, and support systems to create a safe and supportive environment for nurses. By implementing structured reintegration plans, providing education on stress management and healthy coping mechanisms, and accommodating work-life balance, healthcare institutions can support their staff in maintaining sobriety and therefore contributing positively to patient care. As we move forward, it is essential to continue exploring and implementing evidence-based strategies that address the challenges faced by healthcare professionals struggling with chemical dependency. By doing so, we not only support our colleagues in the recovery, but also uphold the highest standards of patient care and safety.